Hi, my name is Lindsay Tom. I'm a physician assistant in rheumatology, and I work at Northern Virginia Center for Arthritis. So let's talk a little bit about CD64 and IL-23 expression in inflamed joint, skin, and gut tissue. We know that IL-23 is a cytokine that drives inflammation in many of these autoimmune conditions, including psoriasis, psoriatic arthritis, inflammatory bowel disease, to include both Crohn's and ulcerative colitis. And we've also seen that myeloid cells that express CD64 are major IL-23 producers, further driving that inflammation cascade. The presence of IL-23 then triggers other amplifiers, including Th17, Th22, and further downstream leads to the release of more cytokines, including the TNF-alpha, IL-17, IL-22, and that leads to even further inflammation that we see with these immune-mediated diseases. So therefore, CD64 plays a role in further driving that inflammation. Now, specifically in terms of skin, joint, and gut tissue, there's been studies completed looking at the biopsies of inflamed skin in psoriasis, and they saw that not only was IL-23 increased, but CD64 was also increased and accounted for a large majority of the IL-23 cells in that area of the skin. In psoriatic arthritis, the expression of CD64 on peripheral blood monocytes has been correlated with joint disease activity. And we've also seen studies that show that CD64 myeloid cells, even in uninflamed enthesitis tissue, could produce IL-23 after stimulation. As we jump into IBD, we saw that the research looking at colonic tissue of patients with active IBD, it had a higher expression of CD64. And CD64 was found as a primary source of IL-23 in that tissue. So given the studies across all these different immune-mediated inflammatory diseases, we've seen that clear correlation and connection between IL-23 and CD64. And that's really important for us to keep in mind as we study the immunology of these diseases and also decide and understand the treatment options and treatment therapies for our patients, including those patients that we put on guselkumab, which uses this mechanism of action. Thank you for listening, and for more information, you can go to the RhAPP website or the RhAPP ACE app.